Welcome. This is,
Hi, thank you, Gina. It's so wonderful to be here with you.
oh, it's wonderful to have you. I'm very happy to have this special Facebook Live Compassion Center with Ethan Bertrand to discuss our friends and colleagues in Isla Vista, what's happening in Isla Vista, how we can support each other in the Isla Vista community. So I'm very appreciative of that. I'll just quickly introduce Ethan, and then we can start our conversation. Ethan's been in Isla Vista for going on 7 years now, so he's a very well-versed person there. He is the director now of the Isla Vista Community Services District, among other and many hats that he has. But that one was the one that I approached him to be on this Facebook Live today. SBRN has been hosting these Facebook Lives since the beginning of COVID in English and Spanish, at least twice a week. We're going to expand to have a youth compassion center. And we're hoping that we will continue to have dialogues like this to inform our friends and our community about developments, particularly in mental health and safety during COVID. And SBRN is there for you 24/7, English and Spanish, if you're needing any psychological assistance. So I apologize if there's a delay in my lag in my speaking. My internet, my cellular service is not the greatest at times, so my apologies. So Ethan, welcome.
Thank you so much. And this is such an important topic. I know when we think of COVID-19, we often think just of the physical health effects, but the mental wellness and our health overall is just so important. So I'm so glad to speak with you on this and how we can stay healthy in Isla Vista.
Absolutely. And I know that one of the reasons we're having this conversation is there has been an increase of COVID positive cases in Isla Vista. And I know you're working with your team and many people in Isla Vista and throughout the community to keep our students and residents safe. Can you talk a little bit of how you're seeing the situation right now and what is currently being put in place to support the community?
Absolutely. So to start out, I'll give you a little bit of a status update just on the cases that we're experiencing. And right now we have had 141 cases in Isla Vista. These are just the confirmed positive cases. So with that, we also know that there are many other people who likely have the virus. And any minute now, the numbers should be updated for today as well. But as of yesterday, 141 people had tested positive for COVID-19. And it's very concerning because, as you know, in Isla Vista, we're a small community. We live very close to one another. So if I have it, it's very possible that I can give it to my neighbor. It's very possible that I can give it to my friends. So that's why it's so important that all of us practice steps to physical distance and to prevent the spread.
Mm-hmm, mm-hmm. So you're finding right now, are there educational campaigns or ways that the information is getting out to students or to the community? What are some of those initiatives that are going on right now?
Yeah, so there are a number of things that we're working on. First of all, we know that trusted partners are so important. And that's why we're really enlisting a lot of help from our students, because we know that students want to hear it from each other. We want to talk about what's relevant as far as how COVID-19 is affecting young people. And that's not just the health effects, but that's also just disrupting the various aspects of a young person's life. A lot of folks are excited to get back to school. A lot of folks are excited to start internships, to enter into new jobs, to explore all that Isla Vista has to offer. And with the situation right now, unfortunately, there's been a pause button hit on a lot of that. So when students are grappling with that and when young people are grappling with that, I think they want to hear from their peers on how we can support each other. So that's how we frame all of our efforts in Isla Vista right now. But with that, our biggest focus is letting residents know about the power that all of us have to keep each other healthy. There are a lot of things that we shouldn't do, a lot of things that we can't do right now. But what we can do is take individual responsibility to look out for each other's health. So that looks like wearing a face mask. That looks like practicing physical distancing. That looks like only hanging out with the people that we live with in person. Of course, we want to stay in touch virtually and from a distance with as many folks as we can during this time, because it's important that we have that peer support network and that we're looking out for each other. But it does involve taking those individual responsibilities. So we're really emphasizing that right now, not just the threat that COVID-19 presents to our community, but also the solution, which is us acting to look out for each other's health. And we're seeing a great response to that. I mean, we're a caring community. Isla Vista residents want to be there for each other. I know you've worked in Isla Vista for many years during challenging times. Ivy is a resilient place. We've been through so much together, especially in the year of 2014, which I think you were working in the community. That's when I was coming to Isla Vista and started working a lot on the efforts to really help our community after that year. But the one thing that we're all the one thing we all have in common is just our love for the community and how we can work together to support each other's health. So to sum it all up, we're really just emphasizing what Isla Vista residents can do to make a difference, and that each of our individual actions can save a life.
Oh, it's so true. I want to address the fact that there is at times a prejudice against young people, or a discrimination of, well, they don't care, they're not going to practice safety. They're, they think they're above it, they are not going to get it. Do you see those attitudes toward the students or among the students? Is there a resistance, or are you finding that there really is that desire to turn this thing around right now?
Yeah, so I think that there's been a bit of a learning curve, because at first we didn't know exactly how this would impact young people. And I think there was a lot of misinformation out there as well. It was unclear just how this would travel through a community, how it could be spread. But the more and more that we've learned, we've realized that this can have a tremendous impact on the health of young people. And many of us, if we get it, we might have a mild case. We may be asymptomatic, which is very dangerous for the spread. But some young people also will get symptoms. Some young people, especially those with pre-existing conditions, could have very concerning symptoms. But all of us are capable of spreading it to someone who could be particularly vulnerable. So like I said, with our learning curve, I think now young people realize that. And we're seeing a lot of folks changing their behavior and doing what they can. When I look out at my neighbors, I see the vast majority of people doing the right thing. And I really want to thank them for that, because I don't know if there's enough appreciation out there for what's happening here. And the Isla Vista kind of hotspot that we're seeing right now with the virus, it's not the first hotspot we've seen in this county. I know you've worked a lot with the Latinx and Indigenous health task force during this pandemic. And we've seen similar hotspots up in the Santa Maria area. And when that happened, we worked together and continue to work together as a community to really get at the root issues and support vulnerable communities in reducing the spread and preventing hotspot outbreaks. And that's the same thing we're going to do in Isla Vista by communicating directly to the issues that we're seeing and supporting each other in protecting each other's health.
Yeah, that's so well put, because we're noticing the efforts that we put in that community in Santa Maria and with the farm workers and all the efforts up in North County, that we're seeing the numbers going down. So all of us coming together, messaging, educating, providing the resources. I thought maybe today we could talk about testing. If students or the community are concerned, where can they get tests right now?
Let's start there. And so that's a great question. And one thing that our viewers will probably realize is it can seem like there's a different answer every day. And I understand how frustrating that is. But with this unprecedented pandemic and with limited resources and ever evolving technology, which is super exciting, there have been many changes in our local testing infrastructure. So I can't speak for what's happened this whole time because it has changed a lot. And there have been times when community members have been encouraged to get tested, whether they have symptoms or not. There have been times when people who are symptomatic have been encouraged to only go and get tested. And right now, we are at a place where we're encouraging people to get tested, while also understanding that folks who are ill, folks who are symptomatic may likely have a priority. So you may have to wait a little bit. But it is good to get tested if you suspect that you have been exposed to someone, if you are exhibiting any symptoms, or if you have any worries like that. So there are a couple of different options. One option that's very exciting and that Isla Vista residents should take advantage of is the County Department of Public Health, in partnership with the state, will be opening up a testing location in early September, so very soon, at the Goleta Valley Community Center in Old Town Goleta. So that's very close to Isla Vista. You can ride your bike there, you can carpool with a friend, you can ride the bus very quickly, and you can go there to get tested. Additionally, I would encourage anyone who's affiliated with a college or university, so if you're a SBCC student or UCSB student, feel free to reach out to your campus's health center for information too, because they may have resources to get you tested sooner than this other community testing site. Additionally, if you do have symptoms, your best bet for the first step is to reach out to your healthcare provider, whether that's the neighborhood clinic, whether that's your campus health provider, a private physician. And if you don't know where to start, you're always welcome to contact the public health department as well. Probably a couple times tonight, I'll mention the public health department's website, because that's really an awesome hub for all of this information. It is publichealthsbc.org, SBC standing for Santa Barbara County. So publichealthsbc.org for all of your COVID information.
And we can put that maybe in our chat or right on the Facebook page. I know that's a website that we recommend and we turn to get all the latest information. It's current and it's got valuable resources. The other thing that I've been working on, creating a safety plan, for instance, for families, and we're creating that in English and Spanish, to what do you do if you are tested positive? How, like kind of making a checklist, and we're doing a very thorough checklist with the public health department so that people can have these in their home. Is that happening in Isla Vista? Are people getting information on what to do if they're tested positive and what those steps are?
Yes, that is happening. We're focused a lot on that at the Isla Vista Community Services District, doing direct outreach, especially digitally, to folks on that. And that transitions well into another point, which is since all of us live so close together, it's important that we're having these discussions with our roommates and housemates to talk about how we can all stay safe, which includes no guests at the moment, unfortunately. It includes washing our hands. We want to be disinfecting surfaces frequently, but then also talking about how we are physically and mentally feeling, and being honest about that. I'll say now is a great time to develop strong relationships with your roommates, because they are going to be the friends that you see for quite a while. So try to build those relationships so that you can be honest about what you're experiencing health-wise. Because if someone is sick, they are going to want to try to quarantine in their home and limit their exposure to their housemates, which in Isla Vista can be incredibly difficult if there are multiple people living in a bedroom, which happens in our student community. But nonetheless, we want to have those conversations. I'll also plug on that note that the public health department countywide is offering temporary housing accommodations to folks who do need to quarantine and do not have the space to do so at their home. So that resource is available as well by visiting the website we mentioned before.
Yeah, I was really pleased to hear I'm on calls with the public health department and that there are hotels, blocks of hotel rooms for people who live in housing like Isla Vista or homes where there's a lot of people so that you can quarantine safely. So please take advantage of those situations. We want you to be safe. And I really, really like what you're saying, Ethan, about talking. You know, I'm in mental health, in the field of mental health, and there is some stigma. I remember when I was, in age, a little older than you are, but we had the AIDS epidemic, and
Hmm.
people were so ashamed to talk about the fact that they had AIDS. Now, in this case, I think there's some shame, and I've heard this from other mental health providers that if someone is tested positive, there's the shame, the stigma, and they don't want to talk about it. They don't want to, they're afraid, and that's because it's a shame based reaction. And we want to clarify that there is no blame in this.
Right.
Very important that we take a positive, open approach. And this is spreading. There is no one to blame for this. So at this point, please, talk openly. And I'm sure you have some things to say about that, but I just want
That's right. And also, contact tracing is occurring right now. So if one of us tests positive, we're going to be getting a call from the public health department along with our close contacts. So it's important that we're honest in those conversations too.
to.
Just like you said, Gina, you couldn't have put it better. There's no shame here, but it is about relaying accurate information so that we can do our best to reduce the spread.
Exactly. Exactly. And so it's important when we talk about mental health, that does include stigma. That does
Yes,
include also people being cavalier. Oh, I'm okay. Both those things are reactions often from fear. Um, so the more we can relax into the fact that we're in the middle of a global pandemic, we're in the company of every country in the world. Yes, we have high rates. Yes, there's a lot to be said about the way things were handled. But nonetheless, if we don't go there, we just are on a universal platform. And that we, as you said, have to be compassionate with each other and with
hmm,
ourselves. Because the spread is only going to stop by us caring for ourselves and for each other. We're doing
that's
this
right.
to keep people safe. And that's including not just our immediate family, but our community. It's a selfless thing to do. And it, it does take courage and strength. But as you said, we're a really caring community.
Totally. And with that, that includes caring about our mental wellness and making sure that we are providing support to each other. And I think that this is especially important for young adults. We've seen very alarming statistics about adults having higher rates of anxiety, depression, and to be honest about it too, more young adults considering or thinking about suicide. And
Absolutely.
it's important that we speak openly about all of these issues. And I really want community members to know that there are people there to help you through this time. That may be a supportive friend, or that may be one of our local service providers, which I'm sure, Gina, you can speak about a little bit.
Mhm.
Um, but there are so many folks who are experiencing challenges right now, and it's totally understandable. None of us expected to go through this, and there's a lot of uncertainty right now. Additionally, a lot of people are out of work. A lot of people are suffering in a variety of ways, and that can be very stressful, and that can take a toll on one's mental wellness. So we definitely want to encourage folks to check in with your friends, be there for each other, check in with yourself, be patient with yourself, love yourself, and know that your mental health is just so important to your overall health and the resilience of our community during this challenging time.
Yeah, absolutely. And being in the field of mental health, and also September is Suicide Prevention and Awareness Month, there's going to be a lot of activities virtually. Most of them will be online, but I'll be sharing those with you just so that we can keep the dialogue. There is, again, the stigma of not talking about having feelings of feeling at the point where I don't know if I can go on, having suicidal thoughts. All of that is not, you're not, again, there's nothing to be shame about. We're all struggling. And so the more we can keep those dialogues open, you can always call the Santa Barbara Response Network. As I said, 24/7 English and Spanish. We'll put the number in the Facebook chat. Our website is sbresponsenetwork.org, and there's resources there. And we can certainly refer people to the UCSB services like CAPS and others, right, Ethan?
Absolutely.
Is that all going on right now still?
That is, yes. And then City College has resources for their students as well. And then my understanding is that Santa Barbara Response Network is also part of the community wellness team with even more resources in this community. So I hope that everyone realizes that there are just so many folks who are here to help right now.
Yeah, the community wellness team is the other number we can put out. And they have, it's a collaborative of most of the mental health agencies in Santa Barbara County. So wherever you are, whatever language, we can get you help. And I've been running these compassion centers, and once or twice a week, we've been featuring all of these mental health agencies. And we are so fortunate that we have just the wealth of resources, from domestic violence to, we talked about suicide, parenting. We also have our elder community, which is possibly, but in Isla Vista, that's an issue too. We have all the demographics right now. There's help, and we want people to know that they're not alone. And
Absolutely.
And people like yourself working tirelessly to get information out. So I really think with all of this that we can bring the numbers down of positive cases, that we can reach out and support each other and be friends to each other during this.
That's right. And I also want to talk about some good news, which is something we all know. There are many safe ways to enjoy our community during this tough time, whether it's hanging out at the beach, getting some exercise like riding your bike, walking, going for a run, spending time at the park. And some of these activities you can perhaps do with a friend from a safe distance. Make sure that you're keeping that distance. That's just so important. But there are a lot of great ways to enjoy our community right now. And I think that a lot of folks are also getting creative with how to interact virtually, which is great to see. And we all long for the day when we're going to be able to get back to something that's just a little bit more normal. But for now, I definitely want to encourage folks to figure out ways to have fun. And that can also be a great way to build community, a great way to promote all of us being in this together. I mean, if anyone has suggestions for different things that we can be doing that we're not doing right now, please share them with your friends and neighbors, because I know a lot of folks are looking for ways to have fun in a safe and healthy manner. And that includes not going to gatherings right now. There have been concerns, especially last weekend, about reports of large parties in Isla Vista. For all the viewers, I want to emphasize that that is not indicative of the behavior of the whole community. It's quite rare, but still, that poses a threat for our control of the virus. So let's focus on the things that we can do that are safe and that promote physical distancing, and let's just really be patient and try to stay away from those higher risk activities.
Mm-hmm. Yeah, I think it is important that we do acknowledge the fact that they do go on. And if they do go on, it is important to say something. And we don't have to be, dogmatic, but we have to say, maybe we can consider doing this differently. I do think that we all have the rise. We were listening recently to John Lewis to, good trouble. We can speak up. We don't have to be heavy about it, but we do have to speak up if we see something. But in the meantime, I like your focus on enjoying the community in every way we can. We live in a beautiful, beautiful situation where we do have nature. But I did feel very fortunate to be able to have you on and have this conversation, because I really love Isla Vista. I spent, as you said, a lot of time there. The Compassion Center was started in Isla Vista after the shootings. We wanted to serve the community, and so we set up compassion centers throughout Isla Vista. And compassion centers are safe spaces where people can be and deal with their feelings and emotions and anything that's coming up, grief. And we also did compassion patrol throughout Isla Vista so that people would have an opportunity to just share what was going on. And it's in that spirit that I hope we do continue to have the compassionate presence in Isla Vista, have those mobile compassionate pockets of response. And that's what got us through Isla Vista. And Isla Vista is such a resilient community. So I know that we will rise up in this situation too. And my heart is, with you all, and just
Thank you.
stay Ethan strong, and know that Ethan's there and his team, and we're here for you too. So reach out anytime.
Absolutely. And it's really a team effort. We are so lucky to have such a rich community of folks who are eager to help. So I want to give a shout out to a number of organizations that are doing great work. Isla Vista Youth Projects, Associated Students of UCSB, the Beloved Community, Isla Vista Community Network, Recreation and Park District, UCSB, Santa Barbara City College, Public Health Department. It's really been a team effort of folks coming together to make a big difference, and that really goes a long way. That's the only way that this is going to work, if we're all working together. And so far we've been working really well together. So I'm grateful for that. I also want to mention a few other services and resources that folks may not know about and may need. Housing is always expensive in Isla Vista. There's always a housing crisis, and it's been extremely exacerbated and intensified by the COVID-19 pandemic. So know that right now there is a eviction protection in place throughout the unincorporated area of Santa Barbara County. So if you're in Isla Vista and you're struggling to pay your rent, know that you will have to pay it, and there will be hopefully some help to help you do that. But know that you cannot be evicted right now. That's something that's been causing a lot of people anxiety. Know that you can reach out to UCSB financial aid or City College financial aid centers for information on some special resources that are available, as well as the Isla Vista Tenants Union. And United Way is also helping in that space as well. So I want folks to know about that. If you are having trouble accessing food right now, the Santa Barbara County Food Bank is doing a lot of great programs, as is the Associated Students Food Bank at UCSB. Definitely take advantage of that. I'll also mention that right now we're seeing a large uptick in homelessness in Isla Vista, a very significant uptick, and we're trying to do our best to help those folks as well, our neighbors who are without homes. So we have a homeless support service site that's open at the Isla Vista Community Center a number of days a week, and there we're giving out free food and trying to connect folks with services. So those are just a little taste of the other resources that are online right now for residents to take advantage of. But for a comprehensive list, everyone can go to islavistacsd.ca.gov or simply Google Isla Vista Community Services District, and we have a COVID-19 resources page to help you out.
Oh, wonderful. Wow, you guys are, I'm so glad that you mentioned these things at the end, because I'm sure they're on everybody's mind. Housing, absolutely. Food, absolutely. Finances, absolutely. Again, besides mental health, now mental health is part of that whole picture of physical and just environmental health, that we feel like our environment is safe and that we have a place to go. So that's all being addressed. So I'm really impressed with all the services, and I really hope the students and the community take advantage of what is there for them. And again, no shame, and just if you need help, please reach out and get these services.
Absolutely. Well, Gina, thank you so much for having me today. It's been a pleasure to speak with you, and we'll continue to work together, and let's stay healthy, Ivy.
You got it.
Take care.
Take care.